Everybody is looking for a healthier life. Start yours with us. Like, comment, and subscribe for your journey to wellness. Let's embrace nature's wisdom together.
Bronchitis is a common respiratory condition that affects millions of people worldwide. It is characterized by the inflammation of the bronchial tubes, which are the air passages that connect the windpipe to the lungs. This condition can cause significant discomfort and can interfere with daily activities. It occurs when the bronchial tubes, which carry air to and from your lungs, become inflamed. This inflammation can be triggered by various factors, including infections, smoking, and exposure to pollutants or other irritants. This inflammation narrows the airways, making it difficult for air to pass through, leading to breathing difficulties and other uncomfortable symptoms. Common symptoms include coughing, wheezing, shortness of breath, and chest discomfort. Imagine your airways as a network of pipes. When these pipes become inflamed and swollen, the airflow is restricted, making it hard to breathe comfortably. This analogy helps to understand why breathing becomes labored and why coughing is a frequent symptom. Bronchitis can be an acute short-term illness or a chronic long-term condition. Acute bronchitis often develops from a cold or other respiratory infection and typically improves within a few days to weeks. Understanding the difference between these two types is crucial for effective management and prevention. Chronic bronchitis, on the other hand, is a more serious condition that is part of a group of lung diseases called chronic obstructive pulmonary disease, COPD. While both types involve inflammation of the bronchial tubes, their causes, duration, and long-term implications differ significantly. Acute bronchitis is usually caused by viral infections, whereas chronic bronchitis is often due to long-term exposure to irritants like tobacco smoke. Proper diagnosis and treatment are essential for managing symptoms and improving quality of life. Acute bronchitis, often referred to as a chest cold, is typically caused by a viral infection, like the common cold or influenza. It's characterized by a sudden onset of symptoms, including coughing, wheezing, and shortness of breath. In most cases, acute bronchitis resolves within a week or two, with symptoms gradually subsiding as the body fights off the infection. Chronic bronchitis, on the other hand, is a more serious condition that persists for months or even years. It's often associated with long-term exposure to irritants like cigarette smoke, air pollution, or chemical fumes. Unlike acute bronchitis, which is temporary, chronic bronchitis causes lasting damage to the airways, leading to persistent cough, mucus production, and breathing difficulties. The contagious nature of bronchitis depends on its underlying cause. Acute bronchitis, primarily caused by viruses, is highly contagious, especially during the first few days of illness. This means that you can easily spread the virus to others through respiratory droplets released when you cough or sneeze. Chronic bronchitis, however, is not contagious. Because it's usually caused by long-term exposure to irritants rather than an infection, you cannot catch chronic bronchitis from someone else. However, it's important to remember that the irritants themselves, like cigarette smoke, can harm the lungs of those around you. The symptoms of bronchitis can vary depending on whether it's acute or chronic. However, some common signs to watch out for include a persistent cough, often producing mucus, is a hallmark symptom of bronchitis. Difficulty breathing, especially during physical activity, is another common complaint. Wheezing, a whistling sound produced when breathing, indicates narrowed airways. A feeling of pressure or tightness in the chest can accompany bronchitis. Feeling tired and run down is common, especially with acute bronchitis. If you experience any of these symptoms, it's important to consult a doctor to determine the cause and receive appropriate treatment. Section 5. The transmission trail. How bronchitis spreads. Acute bronchitis, being contagious, primarily spreads through respiratory droplets released into the air when an infected person coughs or sneezes. These droplets can travel up to 6 feet and infect others who inhale them or touch contaminated surfaces. You can also contract the virus by touching your eyes, nose, or mouth after coming into contact with contaminated surfaces, like doorknobs, phones, or toys. Practicing good hygiene, such as frequent hand washing and covering your mouth and nose when coughing or sneezing, is crucial to prevent the spread of acute bronchitis. Section 6. Protecting yourself and others. Prevention is key. In this section, we will explore the various steps you can take to safeguard your health and the health of those around you. Prevention is not just about avoiding illness, it's about creating a lifestyle that promotes overall well-being. Preventing bronchitis involves a combination of lifestyle choices and hygiene practices. It's essential to understand that small, everyday actions can have a significant impact on your respiratory health. Here are some essential tips to protect yourself and others. Wash your hands frequently. Hand washing is one of the simplest yet most effective ways to prevent the spread of infections. Use soap and water for at least 20 seconds, especially after coughing or sneezing and before eating. Make sure to scrub all parts of your hands, including the back of your hands, between your fingers and under your nails. Avoid close contact with sick individuals. This means keeping a safe distance from anyone showing symptoms of illness, such as coughing or sneezing. If you know someone is sick, maintain a safe distance to reduce your risk of exposure. Get vaccinated. Vaccinations are a crucial part of preventing respiratory infections. Annual flu shots and the pneumococcal vaccine can help prevent some cases of acute bronchitis. Don't smoke. Smoking damages your lungs and weakens your immune system. Smoking significantly increases the risk of both acute and chronic bronchitis. Avoid lung irritants. This includes not only cigarette smoke but also other pollutants that can harm your respiratory system. Minimize exposure to air pollution, chemical fumes, and dust. Wearing a mask in polluted areas and ensuring proper ventilation in your workspace can help protect your lungs. By adopting these preventive measures, you can significantly reduce your risk of developing bronchitis and protect those around you. Remember, prevention is a continuous effort that requires awareness and action. Stay informed, stay healthy. Section 7. Seeking medical advice. When to see a doctor. While some cases of acute bronchitis resolve on their own with home care, it's important to seek medical attention if your symptoms worsen or persist for more than a week. Additionally, if you experience any of the following, consult a doctor immediately. Difficulty breathing or shortness of breath that worsens. High fever, over 100.4 degrees Fahrenheit. Coughing up blood, chest pain, wheezing that doesn't improve with medication. A healthcare professional can accurately diagnose your condition, determine the underlying cause, and recommend the most appropriate treatment plan. Section 8. Managing bronchitis, treatment options. The treatment for bronchitis depends on whether it's acute or chronic and the underlying cause. Acute bronchitis is often caused by viral infections, while chronic bronchitis is usually a result of long-term irritation of the airways, often due to smoking or exposure to pollutants. For acute bronchitis caused by a virus, treatment primarily focuses on relieving symptoms and supporting the body's natural healing process. This may include rest, which is crucial for recovery. Getting plenty of sleep and rest allows your body to fight off the infection more effectively. Fluids are also essential. Staying hydrated helps thin the mucus and makes it easier to cough up. Using a humidifier or taking a hot shower can help loosen mucus and ease breathing. The steam from a humidifier or hot shower can provide significant relief by moistening the airways. Over-the-counter medications can also be beneficial. Pain relievers, cough suppressants, and expectorants can help manage symptoms such as pain, cough, and congestion. However, it's important to use these medications as directed. For chronic bronchitis, treatment aims to control symptoms, prevent complications, and slow the progression of the disease. This often requires a more comprehensive approach. This may involve a combination of lifestyle modifications, medications, and pulmonary rehabilitation. Lifestyle changes such as quitting smoking, avoiding lung irritants, and maintaining a healthy diet are crucial. Medications may include bronchodilators, steroids, and antibiotics if a bacterial infection is present. Pulmonary rehabilitation programs can help improve breathing techniques, increase physical fitness, and provide education on managing the condition. Section 9. Breathing easy again, long-term outlook and complications. The long-term outlook for bronchitis varies depending on the type and severity of the condition. Acute bronchitis typically resolves within a week or two without any long-term complications. However, in rare cases, it can lead to pneumonia, especially in individuals with weakened immune systems. Chronic bronchitis, on the other hand, is a progressive disease that can worsen over time. It can lead to complications like respiratory failure, heart problems, and frequent respiratory infections. Managing chronic bronchitis effectively is crucial to slow its progression and maintain a good quality of life. This involves avoiding triggers, adhering to the prescribed treatment plan, and making healthy lifestyle choices.
Before you go, if you enjoyed this video, hit that like button, drop a comment, and subscribe for more awesome content. Your support means the world to me. Thanks for watching. See you next time.